With more on the earnings at Pfizer and Lilly and also the latest on healthcare reform and the impact on the bottom line of these drug companies is Jeff Kraws. He's CEO and co-founder of Crystal Research. And Jeff, thanks so much for being with us.
Pleasure.
I mean, healthcare reform. I was just talking to Derica Rice of Eli Lilly and the CFO there. I mean, they're preparing for it. Is there money well spent right now in terms of fighting this reform?
I think so. What you want to make sure is that a plan isn't rushed into. The most critical mistake that can be made at this juncture is just changing something like pulling out Social Security, putting in Social Security, changing health care when no president has been successful in doing it since the 1950s. And the impact that it has on society would be huge. So you want to make sure that you're lobbying. You want to make sure that all of the people out there have all of the information so that a fair decision can be made. Sure, you want universal coverage and you want it for everyone, but you don't want it at the expense of people losing the coverage that they have now. You don't want it where it's going to impair.
Losing the drugs that they want, right? I mean, that's
right.
Getting back to the drug makers, losing the drugs that they want.
Well, 63% of drugs dispensed right now and prescribed are already generic. So what the drug companies want to make sure is that rather than just taking a drug from a category and saying, oh, you have a hypertension problem, we're going to give you a generic drug that was built in the 1970s and you know no better, when there's a much better product that's out now, they want to make sure that the patients know when they have the choice that there is a better medication out there. If there's not a better medication, they can't charge a premium for it. All they want is that people have the knowledge so that superior drugs receive premium pricing and inferior drugs, you can substitute a generic.
Jeff, can you quantify for us how much these drug companies could be hit by reform?
Well, the drug companies have already given back. They've said if a health care plan is approved, they're going to give back $80 billion. So it's going to be $80 billion worth of free drugs. That is a huge commitment by the pharmaceutical industry to make, and it was one of the things that helped put them in the limelight in a positive fashion, showing that they are willing to work with the president. Depending on the plan that goes through, generics necessarily from Canada don't kill them. Two of the largest 5 generic drug manufacturers in the world are large-cap pharmaceutical companies. So they're not selling generic versions of their own drugs. The key here is, will you be able to have premium pricing for new and innovative products? Now, there's a lot of different plans going through the White House right now and a lot of different courses that people are proposing, and nothing really has been settled on. So if they took away the ability to have companies innovate and receive premiums for it, we would lose the ability and have the lead. We would lose the lead of healthcare in the United States.
And why is that? Because they would have higher costs with this?
They would have higher costs, and you'd have no incentive. You're not going to take risks to develop drugs if you're not going to get a reward from developing that drug. The key thing people need to remember is people keep harping on pharmaceuticals being the problem. Pharmaceuticals are still less than 10 cents of every dollar spent on healthcare. They're an easy target, but I wouldn't want to be an insurance company right now. I would want to be an HMO, a PPO, the middleman. Pharmaceutical companies have the chore of helping keep people alive and keeping them alive in a healthier fashion for a longer period of time.
So does that mean that they're being disproportionately hit, do you believe in this?
Absolutely. Nowadays they are. With an $80 billion give back, I certainly believe they're being disproportionately hit. Drug companies are the thing that can help keep you alive. The next time your revenue item for the government when you retire is when you pay an estate tax and you're dead. So I don't want my health care plan turned over to the government, and consumers out there are going to learn through fair lobbying campaigns what the impact would be to a pharmaceutical company.
Okay, so outside from being a customer, though, as an investor, if you want to bet on the health care, you would want to stay away from the drug companies, go somewhere else?
No, I wouldn't want to stay away from the drug companies. I'm going to have the belief that common sense will prevail here, much like it did earlier when the Clinton proposal went down. I would not stay away from drug companies. I would be investing in drug companies, but selectively. I would invest in those companies that have differentiated pipelines. I'd certainly be investing in generics. Teva would be a top pick.
Okay.
You know, they're one of the best manufacturers out there. I certainly wouldn't hesitate on the Pfizers. I wouldn't hesitate on the Sandozes of the world.
Okay.
There are good companies out there, and they are going to be the right prescription for financial health.
We're out of time, but thanks so much for stopping by in our studios here. Jeff Kraws, CEO and co-founder of Crystal Research.